Yeah.
Okay, could you just start by telling me your name and your title, please?
Yes, my name is Peter Anderson. I'm the specialist paediatric cystic fibrosis physio for the West of Scotland, based at Yorkhill.
Can you describe your role for me, please?
My role with the patients is to lead their physiotherapy treatments, make sure they have a clear plan for home with their physiotherapy, and when they're unwell, to lead their care in hospital. There's also a team of physios who work alongside or work with me, and I also have a role in making sure that they are looking after the patients okay and that they're happy and that they develop as physios. And I also have a role to lead research and audit within the unit as well.
Would you be able to sum up a day for you, your daily tasks?
Okay, so things vary really from day to day. If you like, a normal day would be starting off knowing what our caseload is, how many patients we've got in the ward. So if we have a team of 2 or 3 physios that are working with us in the team, we have to decide who's looking after those patients for a start off. So usually if a patient comes in unwell, they'll be here for 2 or 3 weeks of extra treatment. So there'll be usually one physiotherapist leading that treatment. So we take the opportunity to delegate the caseload. Everybody knows who they've got to see, and we also at that point review what treatments that patient's getting, and whether we're doing the right thing, whether we could improve on anything, if the patient's improving, if they're not improving. So that's how we start off the day. Then when we see the patients, we do a number of different treatments. For clearing their chests, we'll do their physiotherapy, their chest physiotherapy, which I can go into a bit more if you want a minute. So we'll do the chest physiotherapy in the morning, they'll do that again after lunchtime. The parents are normally with them as well, so the parents do an extra session in the evening. And I also, when they're in with a chest infection, they also have to have an exercise session during the day, because keeping their exercise tolerance up is absolutely vital when they're in hospital for 2 or 3 weeks, especially if they're in regularly. So that would be, if I was just seeing patients, that would be my day with patients. I don't know, I also have other things I have to do, but that would be a day with patients.
Since you started in the job, and your years in the job, would you say that the number of youngsters with cystic fibrosis has increased?
It's not increased. The incidences of cystic fibrosis has stayed reasonably stable to my knowledge anyway. It's not something I've specifically looked at. So the numbers have stayed reasonably stable. About 6 or 7 years ago, we started newborn screening for cystic fibrosis. Previous to that, what used to happen was we would get them at 3 or 4 years old after they had been kind of going to the GP very often with asthma type symptoms, and eventually usually the GP says we'll do a test for different things, and that usually included CF test, and then we were diagnosed at that point. So maybe about 6 or 7 years ago, when we went to newborn screening, we got all those kids 2, 3, 4 years earlier, so we had a big peak at that point, but then that settled down once that caught itself up after a couple of years. There's other things that's changed an awful lot over the time, but the actual numbers have stayed pretty stable.
Can you explain a bit about the actual physiotherapy that a youngster would receive from yourself?
Yeah, so first of all, I'll probably have to give a wee explanation as to what CF does to the lungs so you can understand the treatment. Yeah, is that okay?
Yeah.
So one of the main problems that cystic fibrosis causes, it's a genetic disease, and it makes it difficult to move electrolytes around your body, electrolytes being things like sodium and chloride. And that can cause dehydration of a lot of mucous membranes in your body. A good analogy I try and give to the parents and to the children is, if you eat a big bag of salty peanuts, it makes you very dry because you've dehydrated your mucous membranes in your mouth and in your throat. So it's a bit like that. That's an analogy I use. So the problem that causes is the mucus that's in your lungs normally, and everybody has mucus in their lungs, it's a very normal thing. It's how your lungs keep themselves clean. and free from dust and bacteria. That mucus becomes very thick and sticky, and it sticks to the inside of your lungs. So the basis of chest physiotherapy treatment in cystic fibrosis is to clear that mucus. There is lots of other things that physios have to do in cystic fibrosis and other team members, but that's the mainstay of what we're trying to achieve. The treatment most people are familiar with in cystic fibrosis for their chest physio is, and you usually see on the TV and things, is kind of hanging them upside down or at a tilt and thumping their chest. We used to call that the ketchup bottle method, turning them upside down and thumping them. We've moved on for that, certainly in Yorkhill, moved on for that several years ago, and we do techniques that the children, even at a very early age, preschool, do on their own, and it's based around breathing exercises. So the mucus can plug up the very, very small airways. This thick mucus can plug up the small airways very, very easily. So what you have to do is open up that airway to get air moving in it, in order to get the mucus to unplug from the airway. So you give them devices that they blow into that creates a wee bit of a back pressure, not very much, but just a wee bit of a back pressure into their lungs. And a very simple way of doing that is giving them a bottle of water with about 15 centimetres of water in it. You put a tube right into the bottom of that water, and if they blow against that, it gives them an ideal, just small amount of back pressure. And you put lots of washing up liquid in the water, and bubbles come out, so we call that bubble pet. So that's one of the things the toddlers do. And you can make games out of that, and at the end of a treatment session, you kind of throw bubbles about and try and have a wee laugh with them. So they open up the airways by doing that treatment. Then what you want to do is to get the air to flow fast through the lungs, to move the mucus through the lungs, and there's lots of different ways of doing that. So you can give them specific blowing games, like having quite a wide tube, like an old Smarties tube used to be like, and if you put cotton balls in that, they can blow that out, and it gives a huff type noise. But an ideal way for toddlers and young children is to get them running about the gym, and that's a good way of getting air moving around their lungs. Things can get a bit more complicated than that, but that's a very good routine way of doing it. Get them jumping on trampolines and playing football and things like that, along with doing a pep therapy or bubble pep. So, yeah.
Would you say that as the patient progresses in years, that the onus goes on them for their treatment at home, or is it very much in hospital?
No, one of the things that's changed a lot in my years working in cystic fibrosis is that we are much better at keeping or giving the patient control of the therapy. So when I first started working in cystic fibrosis about 15 years ago, the patients had to have the therapy done for them, or the physiotherapy. So whether that was in hospital, which it was quite a lot, the physio